Okay, our urinary flapboard, which includes the bladder. Should be wedged in here somehow, okay? Now, we've been looking at the urinary flapboard because we've been doing a lot of the arteries and veins stuff on here too, so this is not a new model we've never seen before. We have big giant kidney, okay? So this is another model that's a potential candidate. Okay, we have a blow-up, okay, of the nephron, the glomerulus, collecting duct, etc. So we have this one. And then we have a blow-up of just the glomerulus, okay? So this shows you the glomerulus up close, Bowman's capsule, etc. Now, for some of you on your bench, you have something that looks like this. Okay, it's the same models, they're just located in one area. Big kidney, nephron, Bowman's capsule, and glomerulus blown up. Okay? What I am not going to use, but I'll show you anyway. I'm probably not going to use this one. Okay, because I have so many other options for this, why would I use this thing? Okay? But you can still look at it for fun.
No, this one, this door.
Thank you. Okay. Yes? All right. I'm going to run down the list. I'm just going to follow along what you all have in front of you so that we have everything. Okay? Now, for the first couple, I'm going to use the big giant kidney. Okay, it's just easier. Some of this we already know. What's the red one? Renal vein, ureter. Okay, now this shows you, okay, renal artery, renal vein, and ureter, both of them at the same time as well. It's just a little bigger blow up of what's on Wireman. Okay, the region where we have penetration of the renal artery and renal vein, where the ureter exits, this region is called the hilum. Okay, or hilus, hilum plural. Okay, so this is the hilus of the kidney. It's the indentation. Okay, and we have renal artery, renal vein, ureter. Okay, now you can also see on this model, is on tight. Okay, we have renal artery, renal vein, ureter. Okay, here's the hilus. Yes. This one is nice because there's left and right. So you have to make sure you designate left and right renal artery and vein. Okay? So if I'm holding it, this is right, this is left. Okay, so make sure that if I'm asking you for renal artery and vein, there must be a right or left in front of it. Yes? Yes. Okay? This one's nice too because you see both the ureters. What's this guy? Urinary bladder. Is this a male or a female?
Male.
Male, because what's that? Prostate. I would feel very comfortable putting that on there. Okay?
Sure.
I would definitely, right? Yes. This shows you the two ureters going into the bladder. Okay, here's our two ureters going into the bladder, and then what's the tube leaving the bladder? The urethra. Okay, and you can see, if when I can pass it around, you can see that it's ridged inside your bladder. It's folded so that it can expand and contract back to its normal size. The two entry points for the ureters and the exit point for the urethra, you can see it forms like a little triangle inside your bladder. It's called the trigone of the bladder, okay, which is not on your list. It's just FYI, okay? So you can see where the two ureters would come in and the urethra would leave, okay? And this is a male because there's the prostate, okay? Okay, now we can't ask that because I gave away my trick. Could ask it anyway? Okay. Okay, the next few, it says renal pelvis, calyx, pyramid, papilla, column, cortex. Okay. I'm going to use big giant kidney. Okay. The outer rim here is the renal cortex. Okay. The intersection is the renal medulla. Okay, in here. Okay. The first one says renal pelvis. The renal pelvis is right here. It's a flat basin-like area of the kidney that is continuous with this, which is the ureter, okay? So the renal pelvis, okay, here will collect urine from all areas of this kidney. It'll collect here and then move down into the ureter towards your bladder, okay? So it's like a collecting basin. Yes? Renal pelvis. The renal calyx. Each one of these, here, here, and here, any one of those is a renal calyx. Some of them, in your book, it designates major and minor calyx. The wider openings are a major calyx. The smaller openings are a minor calyx. I don't care if you differentiate between the two. Calyx is fine. So this is here, here, here. Those are all renal calyx.
Oh, the one
Okay.
that's like collecting, dropping all everything on the.
Basically, see how this one I like because it's connected. This shows you the renal pyramid where all the action's happening. This is where most of the nephrons are. This is the renal calyx. So the urine's going to make its way from here, here. It'll pass through this hole and collect in the renal pelvis, then down into the ureter. So it's kind of converging towards the middle. Okay?
So how would we describe the renal pelvis and the renal pelvis?
The renal pelvis is here, so this is the basin. It's much, much larger. It's just the calyx is just the opening that connects it to the renal pyramid. Right there. Big round circle with holes in it. Okay? Okay, the renal pyramid. On this particular model, some of them are raised and some of them are completely flat. This is a renal pyramid. It looks like a pyramid if you tilt it that way, see? It looks like a triangle, like a pyramid if you tilt it on its side, okay? So right like this is one renal pyramid. This is one renal pyramid. Another one, another one, another one. They're not, this is just showing you the renal pyramid in 3D, and this is showing you cross-sectioned, okay? But they're the same structure. So within a single kidney, you will have many renal pyramids, okay? Okay. The renal papilla is the tip of the renal pyramid. So if you look at a single renal pyramid, it comes to a point just before it connects with the renal calyx. That point is called the renal papilla. We remember this from the tongue, yes, and the papillary region of the dermis. A papilla means a bump.